Glasgow Coma Scale. It is an important scale for understanding consciousness in a critical patient, especially in emergency and neurological settings. That's where the Glasgow Coma Scale, or GCS, becomes an essential clinical tool. The GCS helps assess a patient's level of consciousness based on three key components. The first one is eye-opening. Second, verbal response. And third, motor response. Now, let's go to explain in detail. First, let's look at eye-opening, which have a score from 1 to 4. A score of 4 means the patient opens their eyes spontaneously. If they respond to verbal commands, they have 3 score. If their eyes open only in response to pain, the score will be 2. And a score of 1 indicates no eye opening at all. Next, we assess the verbal response, which have a score of 1 to 5. If the patient is oriented, they know who they are, where they are, and what day it is, then the score is 5. A confused but coherent response, then score is 4. Inappropriate words, unrelated to the situation, score 3. Incomprehensible sounds, moaning or groaning, then the score will be 2. And no verbal response at all, they will get 1 score. This category evaluates how well the brain can interpret and produce language. Now the final segment of Glasgow Coma Scale, the motor response, which include scores from 1 to 6. A perfect 6 means the patient obeys commands. When the patient localizes pain, pushing away or reaching toward the stimulus, they have a score of 5. Withdrawal from pain gets 4 score. When they shows flexion to pain, it is an abnormal posture, they will get 3. 2 score indicates extension to pain, it is another abnormal response. And finally, if patient have no motor response at all, they will get 1 score. This category reflects the integrity of the motor pathways in the brain and spinal cord. Now at the end, how to calculate the total GCS score? We simply add the 3 components. Eye, 4 score, plus verbal 5, plus motor 6. It will become a total of 15 score. It is the maximum number. The minimum score is 3. A GCS of 13 to 15 indicates mild injury. 9 to 12 suggests moderate injury. And 8 or below signals a severe brain injury, often requiring immediate intervention. This is all about GCS score. Thanks for watching, and don't forget to like, subscribe, and share for more medical insights.